Hi, this is Nora De Silva. Today's episode is about dry eye syndrome. I am pleased to have with me today Dr. Pratijani. She is an optometrist specialized in dry eye syndrome. With her extensive knowledge in this field, she could help countless individuals getting rid out of discomfort and irritations caused by this syndrome. Today, we will be talking about dry eye causes, symptoms, and how to treat this condition. Hi, Dr. Jani, how are you doing?
Good, thank you, Nora. How are you doing today?
I'm fine, thank you. Thank you so much for coming up today into my channel and your willingness to share the information with the audience.
It is my pleasure. And with this beautiful day today, I'm loving it.
Okay, perfect. Let's start. So the first question will be, what is dry eye syndrome?
The name, as it says, dry eye syndrome, is not just a condition, it's a disease. If it's not treated in initial stages, it can progressively get worse. And it is a multifactorial disease. The syndrome means there are so many other reasons why it can affect the other aspect of your eyes. So it causes the inflammation of the surface of the eye, it causes instability of the tear film, it causes meibomian glands to get blocked, and it can also affect the neurological abnormalities. Some people will have excessive sensation of dry eyes causing pain, and some people do not have any symptoms of dry eyes, which is mainly because the corneal nerves are dead from dry eyes.
Okay, so what causes dry eye?
The causes for dry eyes are many. The simple being aging, menopause, allergies, and sensitivity to environmental factors like fragrance and some weed, ragweed, and those allergies can cause dry eyes. The majority of the predisposing factors are from autoimmune disease. If they had any previous ocular surgeries, if they're wearing contact lenses, if they're on glaucoma medication, they can have dry eyes, and drugs and some systemic diseases can cause dry eyes.
Okay.
The most common drugs that can cause dry eyes are hypertensive medications, antipsychotic medications, antihistamines, anti-Parkinson's disease medications, contraceptive pills, which is so very common for all young girls to take it, and that is one of the major cause for the dry eyes. Diuretics, beta blockers, retinoids, which we all use to look young on our face, causes our meibomian gland to shrink in size, which we are not aware of it. And there's so many times I've told my patient, are you using this product? And they say yes, and that could be one of the reasons why they have dry eyes.
I see.
Hormone replacement therapy for menopause women, that causes dry eyes.
So you talked about menopause. Does that mean women get more of a dry eye syndrome than men?
Yes.
Okay.
It's very common in women. For menopause, if they're taking HRT medication, or if they're on contraceptive pills, or if they're using any of those retinoid medications on the face to look younger or to keep them away from aging, can cause dry eyes.
Okay. How to diagnose a dry eye syndrome?
For the diagnosis, the first thing we start is taking a good history. Where we need to know what is the age of the patient, are they taking any medications, have they had any surgeries. The good history is the first important aspect of dry eye management. And then comes the other part where we take the measurements of the tear film, where we talk about how much is the tear produced. Is the tear filled with debris and oils? If there is a meibomian gland blockage, then there will be too much excessive debris in the eye, which causes tear film to not stay on the eye, and it just runs over your cheeks, causing dry eyes. You can do meibomian gland scanning, which is called meibography. What happens in dry eyes is it also makes your tears more salty, so it gets hyperosmolar, causing irritation and burning and stinging sensation. So we do have equipment to measure the osmolarity of the tears through eye pen. We call it as an eye pen. We also do the examination of the eye with the camera, so where we can see if there's any inflammation of the eyelids, if there's any corneal keratitis. These are all the predisposing factors for causing dry eyes. So these are all the assessment that we would recommend.
Sure. How many types of dry eye are there?
There are two types of dry eyes. One is aqueous dry eye, which is mainly because the tear gland, which is a lacrimal gland, stops producing tears. And it usually happens in patients with autoimmune disease, right? And the second type is evaporative dry eyes. It is mainly because the oil glands that are producing oil to keep the tears on your eye are not enough because of the blockage of the glands. So that is called evaporative dry eyes. Most of the time, majority of the time, it is the meibomian gland, that is evaporative dry eyes is the most commonest condition for the dry eyes, and majority is combined.
What is the treatment option for each case?
The treatment depends upon the severity of the dry eyes. If it is a mild dry eyes, we usually recommend in-office treatments. If it is a moderate dry eyes, it will be a combination of in-office and at-home treatment. And if it is a severe dry eyes, then we have to use special membranes like amniotic membrane, punctal plugs, scleral contact lenses, sometimes even autologous serum, which is nothing but taking the blood and making tears from your blood, which is called autologous serum tears, for the severe dry eye cases. Right? When we talk about at-home treatment, or we usually talk about less screen time, using humidifier, drinking a lot of water, more outdoors, having omega-3 fatty acids, which are made for dry eyes, not any other omega-3s, right? These are all the at-home remedies. When we talk about in-office minor procedures, it will be like LipiFlow treatment, which will open up the meibomian gland so that your tears stay longer on your eye instead of tearing. Then there's an iLux treatment, there is an IPL treatment, there is an RF treatment, and we also have LLLT treatment for dry eyes.
What is LLLT treatment?
It is a low light laser therapy that we give it on to the glands around your eyes. Basically, it's nothing but just some light to warm up the glands, and if they are blocked, it just opens up.
How common is a dry eye, and who is at risk of developing it?
Dry eye is the most commonest condition in countries where the air is very dry, especially in Canada when it is too dry and cold. It's very, very common for us to have dry eyes. Nowadays, because post-COVID, what we have seen is even kids who are 16 years old have meibomian gland dysfunction.
Because of too much using iPad, screen time?
Absolutely, absolutely. And no matter how much we tell them to avoid, it's no possibility. And now the school being online, it's even worse.
Yeah, because you mentioned earlier, age is a factor. But if you say like 16 years old, it means using screen, over time using screen is another factor as well.
True, and because of the screen, they'll have lack of sleep. The teenagers, they're on screen all the time. And if the eyes are not, because when the body is resting, the eyes are not resting because they're on the screen all the time. And that is causing more dry eyes.
So even not enough sleep hours as well affecting the eyes.
Yes, and we have started seeing since post-COVID, even kids are having dry eyes. Earlier it used to be only 45 plus women, which is very most common for us to see it. But nowadays we even see kids with dry eyes.
Sadly,
very sad, very sad. It is our generation, I guess.
Yes. How often someone with a dry eye have their eye checked?
Annual examination for everyone is recommended. With mild dry eyes, annual exam is okay. But if somebody who's got a moderate dry eyes, I would recommend every 6 months. People with severe dry eyes, they need to be seen every 4 months. They would even need, say for example, I'm prescribing them scleral contact lenses for dry eyes. They have to come for follow-up management to see how they are doing with their lenses. If I'm giving them amniotic membrane, I would like to see if their cornea is proper and stays, or they need to redo it again. And if I'm giving them autologous serum tears, then they have to have a prescription from me every time we replenish the because they have to order it from the pharmacy. Without the prescription, they cannot make those tear drops.
Are there any specific considerations for contact lens eye wearers with a dry eye?
First of all, dry eye is a contraindication for contact lens wearer. If a person has a dry eye, first I would recommend not to wear them. And if they still need to wear them for their sports or for their interviews, or if they are a model, then I would advise them only to wear it for that particular time, not all day, 8 to 12 hours of wear.
Okay.
Right? And there are nowadays the contact lens technology is advanced so much that we also have moisture filled contact lenses, so they can wear it for 3-4 hours for their parties and functions and interviews and sports.
Sure. What are the preventive measures that people can take to reduce the factors of getting dry eye syndrome?
The basic thing starts with the lifestyle.
Okay.
They sleep well, they drink a lot of water, they have more outdoor activities, less screen time, I did mention.
Yeah.
Humidifier. Then if they're taking medication, they should let their family doctor know too if they're having dry eyes. Omega-3s, which are very useful in dry eye patients.
Yeah.
Right?
Yeah.
So those are the basic things that they can do it from home, taking care of, so that they don't develop dry eyes.
Sure. Is there any specific food or vitamins that people can consume to reduce the symptoms, or even try to avoid getting the dry eye?
Food, I would say anything that is giving moisture to your skin will help.
Like
oil, like vitamin A rich carrots, papayas, right?
Okay.
But we don't feel that vitamin A deficiency is the major cause of dryness in developed countries.
Sure.
Because we are healthy, we eat well.
Okay.
But it's just our habits which needs to be improved, right?
Okay.
And avoiding all the retinoid based screen on the face creams.
Yeah.
That will help.
So will food with omega-3 will help, like salmon and?
Very much.
Yeah.
Oh yes, the fish, salmon, seafoods. Yeah, the avocado also, they say it's a good one for the dry eyes.
Thank you so much, Dr. Jani, for giving all this important information to the audience, and we will see you in another episode. Thank you so much.
Thank you, Nora, for having me, and it was my pleasure to be here with you all.
I wish you guys and girls that you have enjoyed this episode, and we'll see you soon in the next one. That was Nora De Silva. Thank you.